Well, good morning, everybody. Thanks for joining us. Some of you might know I'm Tony from Mercy St. Luke's Family Medicine. Our office is just down the road in Perrysburg. And we give a talk the third Wednesday of each month. And this month we're talking about depression and anxiety. And I purposely picked the topic for this time of the year because the change of season, some people start to get the winter blues, or what we call in the medical world, the seasonal affective disorder. Sometimes it's when people start to get a little bit more challenged emotionally with their mental health because the holidays are tough for them. We've lost loved ones. The holidays bring good memories, but also sometimes some sad ones, and again, some challenges. So today we have Dr. Kevin Zhang, who's going to talk about depression and anxiety. Just a general overview of what depression is, what anxiety is, what to look for, what is okay to feel this way for a while, but what becomes very concerning that we need to get help for. Being a primary care physician, a family medicine doc, it's typically somebody that hopefully patients feel comfortable in speaking to them about how they're feeling and how to get some assistance. Sometimes it's medication, which they'll go over medications, but some non-medication approaches and things like that. So I think it's a good talk, an informative one. I'll turn it over to him. We'll stick around in case you have any personal questions.
All right, thanks Tony for the introduction. So my name's Ken Zhang, one of the second-year resident physicians working with Tony up at the Mercy Health Lighthouse Way Family Medicine program located just off Dixie Highway in Perrysburg. So when we talk about depression and anxiety, for the purpose of brevity, we're pretty much just when we talk about depression. A lot of the symptoms with anxiety do overlap, so this is really applicable either way. Obviously targeting it more toward an older audience such as yourself, but as we know, depression can affect anyone of any age. So with that being said, depression, I think we all kind of all intuitively have a sense of, what that is, feeling down or sad. And, that can be normal if it's going on, just temporarily, like a few days or, after a major life event that may be tragic or traumatizing. But if it's going on for a long time, typically the length of time that we look at is 6 months or longer, then that's when we start to get worried that this is probably like a long-term or chronic depression, like a major depressive disorder, if you've heard that term. And if you think you or someone you love is being affected by depression, then please have them try and reach out, ask someone for help. Doesn't even necessarily have to be a medical professional. Depression is very common, and more than likely, if you talk to someone, they'll be able to point you in the right direction. One of the great resources we have now in recent years, you might have heard of 988, which is a national, it's almost like a crisis hotline, basically. It's kind of the mental health analog to 911, should be reachable on any public phone. So that's always a good resource if you feel like you're in crisis and need immediate help. And even if you don't, they can at least point you in the direction that you need to go to seek further assistance for yourself or family member or friend. And last but certainly not least, again, this is one of the reasons why it's important to always be established with a primary care doctor, whether that's a family medicine doctor or a internal medicine doctor, or even for ladies out there, your OB-GYN, those are all going to be great resources to talk to about, depression or any other medical problems you might have. And depression is certainly a very real problem. It's not like the 1950s anymore where, we basically believed it didn't exist. Depression is certainly as real and as legitimate as any other problem. So moving on, and then by the way, the handout that you have, it's basically a much longer and more detailed thing from one of the national websites, National Institute of Aging, I believe. That basically covers everything I said in more detail. They can always refer to that. I'm going off in a little more abbreviated outline. So risk factors for depression. So there are a lot of things that can contribute to or precipitate depression. And as with many other conditions, genetics can play a strong role. And certainly having any other mental problem, whether that's mental or physical, stroke, cancer, bipolar disorder, things like that, those can all contribute. And stress about anything, daily life stresses, recently being retired and transitioning, to that new stage of life certainly can be a big thing. People who socially isolate themselves or have lost loved ones and only have people to talk to on a regular basis, that certainly can be a major cause as well. And we also know that people who have issues with sleep, whether it's sleeping too much or sleeping too little, like insomnia, that can be also a major issue as well. Your mind basically resets and recharges when you're sleeping, so it makes sense that if you're not able to do that, then that can actually cause or worsen depression. And people who lead more sedentary lifestyle, don't regularly work out or exercise, even just going for a walk every day, that's been shown to have positive effects for mental health. And last but not least, and hopefully not anyone in this room, but issues with substance abuse, whether that's ongoing or in a previous life, alcohol, drugs, things like that, that can certainly mess with your mind too and cause a worse depression. So we're moving on to signs and symptoms of depression. So, like I said, I think we kind of all have that intuitive sense of that most obvious sign of depression, feeling sad or down or whatever you want to call that. But there's a lot more other symptoms too that maybe less noticeable. You might feel hopeless, you might feel guilty about something, but you can't quite identify what exactly. Feeling hopeless, if you're feeling more irritable, you're feeling less interested in activities that you normally would want to do, and you can't really quite explain why. Just feel tired all the time or fatigued, low energy, even if you're getting enough rest. If you're having trouble concentrating and thinking and making decisions, that can also be a sign. And again, going back to sleep, sleeping too much. If you're sleeping, for let's say 12, 14 hours straight per day and still not well rested, then that can be a sign of depression as well. And we often see depression affect people's eating habits too. So eating less, eating more. I personally have seen examples of both. I've heard about binge eating disorders, and often people with that often have depression as well, or vice versa. And that can certainly cause other mental problems. Obviously, if you're not eating enough, you're going to become, suffer from the effects of malnutrition, and that's a good direction to go down towards. So, and obviously the most severe symptoms, usually we see in people with untreated depression, thoughts of harming themselves, and in rare cases, thoughts of harming others as well. So certainly, if if you're having any thoughts or become aware that someone else may be having those thoughts, then definitely very important to reach out to someone as soon as possible. All right, but probably the most important thing, probably I'm guessing what you guys want to know about, so how is depression treated? So like any other medical problem, especially these days where more and more is becoming known about depression and anxiety and other mental health conditions, there are a number of approaches. Probably the first and most obvious thing that we think of is medication. And even within that, I'm not going to go into the nitty gritty, but there are different classes of medications that can help with depression. You've got traditional antidepressants, like you might have heard of SSRIs. Those are usually going to be what we turn to first. And then there are definitely more exotic medications with different mechanisms of action and how they affect your brain cells differently, each with their own, lists of benefits and unfortunately also potentially side effects as well. So that's something as doctors we certainly look at. And some people may do better on one medication, some people may do better on another, and sometimes it can be a bit of trial and error, but medication, I would say, plays probably at least a 50% role in treating depression these days. So definitely can be effective. And then of course there's also going to be things like therapy, and there are also specific types of therapy as well, cognitive behavioral therapy, trauma informed therapy for people whose depression or anxiety stem from a previous or recent traumatic experience, all sorts of stuff in that regard. And I'm not a psychologist, but there are people with advanced doctorate degrees who do this kind of therapy and are specifically trained in different modalities of therapy that can be very effective as well, especially if there's an underlying cause or event of, that's causing someone to be different. And you might have seen this in the movies or on TV. There are certainly more exotic approaches like electroconvulsive therapy, which applies electrical currents to the brain, magnetic stimulation of the brain with magnets, all sorts of fancy cool stuff that has been shown to help. So lots of options out there. Certainly in 2023, depression, anxiety, and I don't think something that anyone should feel hopeless about, especially if they haven't been treated. So, and then just a special note with regard to the older population, there is kind of this increasing recognition that people with forms of dementia like Alzheimer's disease, depression may be under-recognized in people who have that. Because sometimes it can be hard to tell, what they're feeling. They may not be expressing how they feel. So, if you or have a family member who has dementia, just make sure you're checking in on them because statistically there's a higher chance that they could have other things going on as a result of or in addition to their dementia diagnosis. And just going off that, the opposite is also true. So people who have untreated or undertreated depression, anxiety, other mental health disorders, if it goes on too long and as they age, it does increase the risk they may develop dementia as well. So there's certainly benefits to recognizing this and treating it appropriately. Okay, so going off that last note, how do we prevent depression? And I don't think there's really good evidence that says do this one thing and you'll be guaranteed to never have depression ever. That's certainly not true. But just like anything else, any other complex disease process that we don't fully understand, there's a lot of things you can do. So again, staying physically active, getting enough sleep, eating healthy. You might have heard of that brain gut axis, brain and body and, you are what you eat, that's basically all true. And, making sure you're not socially isolated, as we touched on previously. You want to be talking to someone regularly, not keeping your thoughts to yourself, especially if you're concerned that you might be depressed. And going off that, talking to people who have depression, that can really make your day. So, and doing the things that you like to do, that's always a good, measure for, your own well-being, but also if you suddenly find yourself not doing the things you like to do, then that's not where something you should stop and ask yourself, why is that the case? And then of course, again, talking to people, friends, family, your doctor, especially if you're concerned that, you or someone might be exhibiting signs of. So. So that's pretty much all I had in terms of the formal talk. And got some more resources, up there. It's actually not my handout, but, a lot of other, like the, suicide prevention hotline, things like that. Although nowadays probably easier to call 988. Now that we have that, that's good research as well. Any questions I can answer? We're pretty much only scratching the surface of